All right. Hey, this is Dr. Drew with Revival Health Center, and I'm here with Kelsey from Sister Village, and she's a doula. And I think today, when I think of the word doula or what a doula is, I think about empowerment. I think about empowering a mom, a future mom, somebody who wants to be a mom to have a really great pregnancy. And from what we see with seeing a lot of pregnant moms at our chiropractic office, is unfortunately it's like almost you have to have pain. Pregnancy has to not feel well. You have to have low energy, and labor is not going to go well. And our big idea is just helping people to pursue that with the best health possible too. So Kelsey, in your like mind's eye, how would you like describe the importance of a doula and what you
Yeah,
actually do into?
and I think every doula is going to have their own response to this because it kind of comes from that, like what drove you to be a doula. But for us, I'm going to piggyback on what you said about being empowered. Once we kind of fell into this space, we were just like, how can we have these birth outcomes that women deserve if we're not empowered, because we're not really getting the full picture, right? We're not getting the full information, and we could go into why that is later. But what a doula can bring to someone who's ready to have a baby or they're already pregnant is that information that, or guide them to find that information so that they are getting the full picture and they can make decisions with all that information, because we don't make good decisions when we are only getting bits and pieces of the information, right? That's not an empowered decision. So just kind of like guiding you to find that information, so that you can really feel confident that you are getting the full picture. And birth matters. And so it's our experience. And we talk a lot about how women who are 80 years old, 90 years old, like they might be losing their memory, that kind of thing. But what they do remember, even at that age, is their birth. And so, yes, of course, we want a healthy mom and we want a healthy baby, but the experience is so much more than that. And so having a doula on that journey can just really help guide you to make those decisions that afterwards you say, okay, like no matter what happened, I felt equipped to make the decisions that I had to make, and my provider wasn't making those decisions for me. So yeah, that to me is kind of like what a doula is.
And I think something too that like we can talk about a little bit is people tend to just put a doula and a midwife together because they don't know the differences. And oftentimes it's like, oh, well, I have a midwife, everything's covered, and or I have a doula and everything's covered. But like really it's a synergistic relationship, I would argue.
100%.
And they work together rather than being something where like one without the other. So if you were to like maybe, I don't know, it doesn't need to be a bullet point list, but like what's the difference like, and why does it work to have a midwife and doula work together rather than being separate entities, or an OBGYN and doula, whatever you want to say, but like the different types of providers then too, right?
Yeah, the biggest reason is a doula doesn't perform medical, we don't have medical responsibilities, right? Like we're not that medical personnel for you. So we're not your provider. We're there for support, and we can offer physical support, but that's more as in like comfort management, right? So we're doing counter pressure on your hips when you're feeling those intense waves, that kind of thing. We're never performing any kind of our scope of practice is really important, right? Because we don't intersect really with that medical scope of practice that a midwife or a OB would. We're doulas, we believe in the midwifery model of care. So really when you are expecting, you have a choice. Do I want to go and get like the traditional model of care, which would be like with an OB? Sometimes there's pre-existing conditions that are going to force you to go down that avenue too. Or am I going to go with a midwife? And statistically, we know that midwifery care results in better outcomes for mother and baby. So that's why doulas support that model of care. That's kind of why we work synergistically. And I think midwives tend to respect the work that doulas do, maybe more than the traditional model of care does. And so just like the way we work together, we just support each other a little bit more cohesively than you would But that doesn't mean that if you're seeing an OB that you shouldn't hire a doula, because we attend, all kinds of births, right?
Yeah.
And so, yeah, there's lots of different ways you can go, and there's lots of different doulas. I think finding a doula that aligns with who you are and what your goals are for your birth is a big part of it too. But we're just not the same as a midwife.
Well, that was kind of the next thing that I thought of as you were talking too, was goals, right? Like, I think that one thing a doula can provide is a plan. Like, I tell people a lot, like, I think that there's something about having a plan for your health, a plan for whatever else. It doesn't have to be like written in stone. This is how things has to go. But, and speaking from a male point of view, or from, husband or soon to be dad or whatever you want to say, as a father point of view, like, feeling like you're a part of the pregnancy and a part of labor and delivery, I think is really powerful. And sometimes just dads don't know what to do, right? And so I think a doula can empower, and maybe this is selfish coming from like again, from my point of view, but like a doula can help both mom and dad know, like, hey, you can help out, you can be a part of this. You don't have to just like sit in a corner and be whatever. Like, I think an empowering plan for everyone is a huge part of that then too. So what would you say is, like, let's say it's a expectant mom, first pregnancy. What are some things that you would recommend as far as just like overall, and like what a doula can truly help out with that then too?
Yeah. So I'm going to go off on a tangent for a second, just because we're talking about the partner support. But I think we talked about what's the most surprising thing that a doula does. And sometimes, like, a husband or whoever's going to be with you in the birth room, they're kind of like, do we really need a doula? Like, I'm here, right? Like, what do we need another support person? And then they're surprised by how much a doula, that support person, is there for the mother, of course, right? That's our priority. But the husband, the dad, they always feel like so surprised by how supported they felt. And they're kind of like, wow, I don't know what I was thinking to do that without you, kind of thing. So we hear that all the time. But as far as planning with a doula, are non-negotiable when we hire clients, or when it's a mutual agreement that we have come to with a client, is that you do birth education. And I think that surprises a lot of people. Outside of the hospital would be our hopes for you. Hospital birth classes are great, but typically they're to teach you how to be a patient rather than how to make decisions for yourself and for the birth that you kind of want to. So our role is 100% developing that birth plan, and really putting it on paper. Doesn't mean it'll exactly go that way. No, but we have a plan. We know our vision, and then that makes the communication to your birth team that much more, it just goes so much more smoothly when that is just like organized, right? And a doula can really help you with your options and knowing, okay, what are my choices around induction? What are my choices around all the facets of birth and how that can go? Just because there's a lot of decisions. People are surprised by how many decisions they have to make when they're actually in labor, and that's not always the time to just be like making these decisions. Having like forethought and plan prior to that, so that you can just really focus on the task at hand, is huge. So we definitely do a lot of planning.
Totally. And I think it's one of those things too, where like preparation can make a big part for everyone involved. I don't know how many times we've had, and I love when people call regardless, but they might be, 37, 38 weeks pregnant, and they call and say, hey, we're Webster certified. So we see a lot of moms and helping out with baby being the most optimal position for birth, but they'll call at 37 weeks or maybe even 39, and they're baby's head up or they're transverse or whatever else. And like, hey, I heard you can help out with that. And I said, yeah, absolutely. But what I typically tell people is that oftentimes it's getting adjusted through pregnancy can help, so that when you get to that point, there's a lot more ease. The ligaments are moving better, rather than it's the bottom of the ninth, 2 outs, and I hope that this can do everything. And I would say the same thing really goes with a doula thing too, where you're not just like calling right at the end and saying, hey, and that's okay, right? If the people call, like, that's not bad.
No, not at all.
But,
we're always
it can take a lot of the stress and the ease out of it to actually like make a plan and to say that like, hey, we're graduating through pregnancy really well here, rather than, okay, I'm freaking out, I need someone to come intervene. Like, when would you say is the best time to like reach out to a doula to like start to make some of those plans if someone is currently pregnant?
Yeah, that's a great question. We will take someone at 39 weeks, you know, if that fits into our schedule, but ideally sometime early on in the second trimester. So to really cover all of our bases, because there's so much decision making that happens so early on in our pregnancy that impacts how like things will go later on. It's so important to start having those conversations early and like absorbing that information early, right? Because there can
Yeah.
be just a lot of information and you'll think, oh gosh, why is someone not telling me this? And it's just a little bit more digestible when we're starting in that second trimester. So and I think most doulas like to meet 2 or 3 times with clients before they have a baby. So meeting in the second trimester, that allows us to meet once in the second trimester and once or twice in the third trimester. And it just really like spaces that out. We get to know each other. Like, this relationship that we have with our clients is so important, because we know how important it is to trust the people on our birth team in our labor and delivery. And that impacts how our labor plays out, right? When our body senses and our nervous system feels safe around those people, then labor progresses so much more fluid. When we are feeling tense and our nervous system is kind of like flighty and we don't trust the people that are with us, or we don't feel comfortable in the space that we're in, that's when our body, you know, our body's not broken. Our body just inherently knows what feels safe. And so it's really important to kind of build that relationship through those meetings. And
And I think also with that too, like a doula isn't just for the first pregnancy for a mom, right? Like, I think that there's moms that may or may not have had a doula with their first child or second child, or name how many kids they have had previously, but like, it never is wrong to continue to plan and to make it as most impactful. And I've actually had people at the office say, man, I just didn't know. I didn't know what was possible with our first pregnancy or our first labor and delivery. And I wish that you can't go back, but it's like, now I just feel so much more informed leading up to this next pregnancy, rather than like, I just feel as stressed out as ever then too. Right. So like I said, you do work with a lot of like people that have multiple.
Yeah, I would say honestly, the bulk of our clients are second, third time moms, because maybe they had somewhat of a traumatic experience the first time, or things just didn't go how they thought they were going to go the first time. And then in trying to figure out how they can avoid that the second time, they come across doula and they see, oh, statistically, like, hiring a doula, even though we don't perform those medical duties, just our presence statistically shows better birth outcomes.
Totally.
And just
and then also I would argue too, outcomes, like people often think of labor and delivery as like literally just the delivery, but even postpartum outcomes too, right? Like, if you're super stressed out and whatever else with the actual labor and delivery, it's tough to then re-regulate. We talk about nervous system care all the time, and it's tough postpartum to be like, when you got a new baby in your hands and you're doing all the things with that too. So I think that it's the prep work to excel postpartum, rather than like, oh, delivery's done, everything's supposed to just like figure itself out.
Yeah.
Right?
No, that's like the biggest misconception about birth, right? Is that it's just this isolated experience. And that's kind of where we birth the name of our birth education class, is that birth matters. And so much of what happens in birth affects how we feel postpartum, how our baby latches at the breast, how, you know, our body recovers postpartum. And so, yeah, to just know that ahead of time can really make or break your experience after the fact.
Yeah, so you alluded to it a little bit just then, but tell me a little bit about what you guys are working on currently with your own company, and I'll be quiet. What are you actually working on here now?
Yeah, thanks. So this is a long time coming for us. We knew we loved the education piece, and there's only so much we can go into in those prenatal appointments. So it was kind of like our clients would be like, tell us more. Like, we're really intrigued by this information, especially if they hadn't taken a birth class outside of the hospital. And so there's great options. I think the pandemic turned a lot of people to go to that virtual style of learning, which might work for some people, but there's just something about that in-person education. And so, yeah, we are doing it's called Birth Matters. It's a birth education class. It's a really comprehensive class. I would say I'm probably biased, but what we're including is a lot of things that are maybe other people think are out of the box or aren't as discussed as much when you do birth education. So yeah, how does our birth affect our nervous system? How does it affect our baby's development? How does it affect how we breastfeed and that kind of thing? So we're certified lactation educators as well. So there's just lots of different pieces that we're going to put into our birth education class and build this community, right? There's just a sense of community that we don't always get when it's virtual. And so to offer that to our community and bring back that sense of community, that sense of, discussing things with other people who are going through similar situations that we've kind of moved away from, I think is really important and something that we want to start
I think
offering.
that's a lot of healthcare right now, though, too, right? Like, there's a lot of investment, like literally financial investment, in a lot of telehealth in that age, and a lot of the virtual health and virtual education classes for providers too. And
Which
I
is
think
great, it has its place. But I don't think that we should entirely erase that in-person education and that
and that's
in-person.
that's what I was getting at too, was just that, like, people come in so often to the office and they're like, it just feels good to actually be in in an office and to get to talk to you and feel like I can be myself and feel like we just want people to feel warm and welcome when they come into an office, rather than feeling like, I know we're recording this on a computer, so maybe that's a part of it then too, but feeling like I have to wait, or there's some disconnect in between me and my provider, me and whoever else it is then too. So when you plan on doing that, when is that going to get rolled out, or is that still in the planning phase?
No, yes. So we are going to hold these birth classes. It's called Sanctuary Health and Yoga in Webster City. It's a yoga place that is so gracefully offered their space for us. I think it's just a really, like you said, that comfort and a really neat space to offer our classes. So they start. The date is I'm gonna lose the date, but we start in August, mid-August, that we'll be offering that. It's going to run for 4 weeks for 2 hours for each session. So I know, like, quick information is so important to people now, but really to cover everything, to make, help parents feel as informed as possible. We need that time. And so 4 weeks together, we can do so much more when we're in the space together, especially when it comes to movement. I know you talked a lot about like optimal positions for baby and that kind of thing. There's just a lot that we can be doing with our bodies to help prepare for labor and delivery that is hard to practice or to get explained over a computer. So yeah.
I love it. No, that's awesome. Thanks for sharing. I think we're, just for my wife and I can speak for her too. It's just exciting to see people that are expanding and sharing more of this with people. And we just always hope to be a vessel to have people feel more empowered about wherever they're at in life, right? And I think so often, unfortunately, like you said earlier too, pregnancy kind of just gets like this little like area by itself, as far as like, hey, just work as hard as you possibly can and keep working through pregnancy, and then take a couple months off postpartum and you'll be good, right? And I think one of the things is we just want people to feel like they can, and I say nourishment, like not just nutrition, but like really like feel like they feel nourished through all of that process, nervous system wise, brain health wise, like mental health wise, as far as like I'm right where I'm supposed to be, versus wishing that I was doing something differently, or not even knowing that I could do something differently. And feeling they can really like take off with that too. Before we head out here, any closing thoughts, things that I missed, things that you wish people, male, female, whoever, knew more about, like what a doula actually is about, or how they can feel more empowered along their health journey too?
Sure. I mean, we live in this age of technology, as we're talking about. So there's so much information out there, but there really is incredible like free resources. So I always tell people, first stop, if you feel like maybe birth education isn't something that's feasible for you and your family right now, there's evidence-based birth, and so it's an online resource for parents, and you probably refer people there, your patients all the time. But that you can digest that information by reading it, by listening to Rebecca's podcast, and really it allows someone else has sifted through that evidence. We don't have the time always. We don't have the capacity to sift through that information. So starting there is a really great spot. Send us a message, Sister Village Iowa on Instagram, and we can send you our free resource guide too. And that just has like our top probably 10 or 15 resources that parents can find. So
I love it. I was going to ask you to say if people will reach out to you, but you already did that. So, hey, thank you for your time. This is really fun to get to talk on this. And again, I think the big idea behind a lot of this conversation that I come back to is like, information is important. You should feel informed. You should feel like you have access to things and feel like you can make empowered decisions for not just yourself, but your whole family then too. So thank you again for your time. We appreciate it, Kelsey.
Yep. Take care.